I'm streaming on Facebook. It's starting in a couple of seconds. Assalamu alaikum wa rahmatullahi wa barakatuh. We'll start the program soon, inshallah.
مبارك مين مثلا
Sisters, please.
Bismillah ar-Rahman ar-Rahim. Bismillah, alhamdulillah, wa salatu wa salam ala Rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul uqdatan min lisani yafqahu qawli. Assalamu alaikum wa rahmatullahi wa barakatuh. All right, alhamdulillah. So we have 41 minutes, and inshallah, we'll get through as much as we can, and we'll go from there. So tonight's topic is anxiety disorders. My name is Syed. I am a resident physician at the University of Kansas Medical Center. Alhamdulillah, have this opportunity to share some information and knowledge about mental health. So let's get right into it. Anxiety disorders is what we're going to start with, and I'm going to be talking about two specific anxiety disorders tonight, inshallah. These are the most common. The first one is going to be generalized anxiety disorder, or GAD, and the second one is called social anxiety disorder, or SAD. And here we go. So generalized anxiety disorder, signs and symptoms. So we'll get into right into the signs and symptoms. The hallmark sign of, when, and I want to preface, before I start the signs and symptoms, I want to let everyone know that anxiety in and of itself is not necessarily a bad thing. When we're anxious about something, we have homework due, we have a project due, we have work to do, we have the, house to clean, or, whatever. All of these things, this worry can make people productive. This stress and this anxiety and this anxiousness makes people productive. We do our homework, we do our project, we work on things, we meet our deadlines. And so it's a natural feeling. Anxiety is a natural feeling. It only becomes a disorder when it starts affecting our social, occupational, everyday. It starts interfering in our lives in a way that's detrimental, and it starts causing symptoms that are abnormal, that are not part of normal anxiety, appears to be. So when it becomes excessive and it starts interfering, we call it excessive anxiety and worry that occurs more days than not for a minimum for at least 6 months or more, about a number of events and activities such as work or school performance. Another big symptom is individuals find the worry very difficult to control, and it's very hard for individuals to control this worry, and that's also a very hallmark sign. And it's associated with 3 or more of the following 6 symptoms that are present concurrently at the same time, along with the excessive worry that's difficult to control. And now these are the 3 of the symptoms. So for adults, you need 3 symptoms that are present along with the excessive worry and difficult to control. But in children, adolescents, so before the age of 17, you only need 1 of these items and not all 3. So let's get into these signs and symptoms. So along with the excessive worry and along with the difficulty in controlling that worry, there are feelings of restlessness, or feeling like we're on edge or we're keyed up, and just this inability to be able to relax. Another thing is just kind of feeling fatigued and tired. And then let me go to number 6 first. There's a sleep disturbance. So a lot of individuals who experience severe anxiety are unable to sleep at night because they describe their mind, it's racing. It just won't slow down. It keeps going and going. They lie down to sleep at night. They're thinking about what happened during the day. They're thinking about what's coming tomorrow. And they're thinking about so many different things, and all different, and their mind just does not slow down. And so if we look at sign number 2, when we're not getting good sleep and it's difficulty to fall asleep because our mind keeps racing, we're not going to be very refreshed during the day. So sign number 2, those patients, people feel very fatigued and tired during the day. And if we're not sleeping, if we look at sign number 4, we're not sleeping, we're tired, we're probably going to be a little irritable because we're not sleeping, we're not getting that rest, we're feeling restless. So we're going to be irritable around other people. It could be our children, it could be our friends, it could be our colleagues. We'll be very irritable around them. And sometimes, we're so anxious, it makes our mind go, just mind goes blank and we have trouble concentrating and focusing. And a lot of these things are related to problem with sleep, because sleep affects every other avenue of our physical and mental health. So a lot of these symptoms stem from that. There's a mnemonic, I'm not sure, there's people who like them and there's people who hate them, but there's a mnemonic, there's a mnemonic that can, that we can think about in order to remember some of these symptoms. It says B, skin, and B, blank mind, E, easily fatigued, S, sleep disturbance, K is for keyed up or restless or on edge, I is irritability, and M is muscle tension. If we're really tense because we're anxious, when we keep that posture, day after day, week after week, month after month, years after years, we start to feel tense muscles and pain in our muscles. And so we realize, I don't know, but I'm just hurting in my back and my shoulder and it's just because it affects, anxiety can affect our, posture and the way we're all tensed up and worried. And over time, when we hold these postures for a long period of time, it becomes painful. So we get this tense muscles, muscle tension. Okay, so like I was saying, it becomes a problem when there's such significant amount of anxiety or worry that it starts impairing our social, occupational, or other important areas of functioning. If we start to do poorly in school, if we start to get in trouble at work, because, we're just so worried and constantly on edge that we're always just worried about things that we kind of shut down, that's when it becomes a significant issue. One thing to remember is some people might look like, they're anxious, but we have to rule out, physiological effects of certain things. There are certain substances, recreational drugs and other things, that can make people anxious. There's stimulant medications, there's Adderall. I'm sure everyone's heard of some of these medications. If someone is on stimulant medications, they'll probably feel, one of the side effects of some of these things is anxiety. There's recreational substances like there's, cocaine, heroin, PCP. All of these are stimulants and they can cause a lot of anxiety. So we have to make sure that that's not what's going on. And then there's medical conditions that can cause what appears to be anxiety. An example I gave here is hyperthyroidism. If our thyroid is hyperactive, people will be very anxious and they'll feel all of these symptoms we've described, but it's not because it's a mental issue going on. It's because their thyroid levels are extremely high and their thyroid's hyperactive. So when we notice these signs and symptoms, the first thing we should do is we should consult our doctors so they can rule out anything medical or physiological or other things in order to kind of really get to the bottom of what's going on, inshallah. So the course prevalence and development, the prevalence, development, and course. So how common is generalized anxiety disorder? So it says a 2.9% rate from in adolescents, about 1%, and in adults, it's about 2.9%. So if we're a population of, in the US, about 350, 400 million people, roughly, if you take a 1% of that, or, for adolescents and 3% of that for adults, that's a lot of people. That's a lot of people, even if it, looks like it's 1% and 3%. Of 350 plus million people is a lot of people. So it's a very significant and common issue. The median age, it varies. It actually has a bimodal distribution. What that means is it starts early in teens. It starts early in teens, as young as, 13, 14, 15. And then, it peaks around young adulthood in the late 20s and 30s and 40s. And then as we get into a different age, into 40s, 50s, and 60s, it starts to, go down and improve. But it's the worst, and it peaks around 30 years for most individuals. And so that's why it says here, a lot of people will say that they felt anxious and nervous all of their lives. They've always been anxious, always been worried. And younger adults experience a greater severity of symptoms than the older adults. So when we get into our 50s and 60s in the geriatric older population, their symptoms are much less severe, and young adults in their 20s, 30s, and 40s experience it more severely. So children and adolescents worry a lot about school and doing how they're doing in sports performance, school performance. And then older individuals and older adults will have worries and concerns about the well-being of their family, their children, their own physical health, maybe finances, what's going to happen tomorrow, uncertainties about the future. So some risk factors, gender and functional consequences. This is an interesting slide. So 33% risk of experiencing, severe anxiety is genetic. So if, so a third of the patients who have issues with severe anxiety, it's genetic, passed down from, parents. So if there's a family history, that's important to consider. Females are 2 to 3 times as likely as males to experience generalized anxiety disorder. So I hope we have 2 to 3 times sisters in attendance tonight, inshallah. From the looks of it, I think we do. That's just what the association is. Also, it says individuals from developed countries are more likely than individuals from non-developed countries to report to have experienced these symptoms. And we can get into talk about this and why this could be in our group chat, inshallah. There's some interesting thoughts I have on this, why developed countries have worsening worries than undeveloped countries. Importantly, the excessive worrying can impair the ability with individuals who have GAD to instill confidence in their children. So if the mother or the father has issues with anxiety, they're always worried. It's hard for them to pass on confidence to their children because they're always worried. So they might be just passing down this worry, down the generations. And so that's something to, think about. And then adverse childhood experiences and parental overprotection. We've talked about the helicopter parents, right? So adverse childhood experiences and parental overprotection are also associated with generalized anxiety disorder. When we don't give our children who now are 14, 15, 16, we don't give them some sort of trust and some level of freedom, some freedom to kind of express themselves and, kind of grow and give them that responsibility and trust for always kind of doing everything for them and all of these things. And it'll be difficult for them to kind of, because we're always worried. So we can pass those things down. So something to be considered, to think about as well. So there is something we call a panic attack specifier for generalized anxiety. So when the anxiety is so severe, when the anxiety gets so bad and so terrible, we start feeling physical symptoms of anxiety, like physically in our bodies. Now, what does this look like? There's a number of, I got about 13 here, but people can start trembling and shaking. They can start sweating. They can start feeling dizzy or lightheaded or even faint. Derealization, depersonalization is just kind of feeling like you're not even like you're outside of your own body and you don't even know what's real and what's not real. We're almost like disassociated from ourselves. And then, when people feel severely anxious, their heart can beat really fast. They can have palpitations or a pounding heart. They can feel nauseous or get abdominal cramps, tingling, numbness on their arms and legs, shortness of breath. They might be hyperventilating, can't breathe properly. They might think that they're going crazy, or they think that they're having a heart attack. We have patients that show up to the emergency room all the time. I'm having a heart attack. And we check their EKG, we check their, troponins, their blood work, everything is normal. And then we realized they were just having a panic attack, because it can manifest as even chest pain or chest tightness. And so a lot of patients sometimes come to the emergency room and they're like, oh, I think I'm dying, I'm having a heart attack. So it can get pretty serious. So that chest pain or discomfort, and then feeling like we're choking and chills and heat sensations. This is what we call this. There's a screening tool, and I'll share the link in our group, inshallah. But this is a screening tool that can kind of score whether someone screens positive or negative for generalized anxiety. It's a 7-item scale. It's called the GAD-7. The GAD-7 screening tool, and it asks you 7 questions. That it's a Likert scale that goes from 0 to 3. 0 being not sure at all, and 3 to be like it happens every day, all day, multiple times a day. So like feeling nervous or anxious or on edge, not being able to stop or control worrying. So these are all those same symptoms that we already went over, and this will just score it. And based on the score, doctors will give this to patients to screen them. And if they screen positive, then they will talk to them about that. So now we've described the symptoms, the signs and the symptoms, and some epidemiology and other considerations. We can talk a little bit about treatment considerations as well. So CBT is cognitive behavioral therapy. It's a form of psychotherapy. It's a first-line option. So no medications, just talk therapy. It's a first-line option for treatment of generalized anxiety disorders. And it's as effective as medications, pharmacotherapy, or medications. A lot now we're in the pandemic, if you get a therapist appointment, it's virtual. So computer-based CBT, virtual therapy appointments they've also demonstrated to be effective. And so if patients do not benefit from psychotherapy, there are medications that are approved for generalized anxiety disorder, or a combination of one or the other or both. But for children and adolescents, therapy treatments are preferred over medications. So for all children and adolescents below the age of 18, it's recommended to do talk therapy and not medications. And now we'll get into our second topic for today. This is the second. So these two are both very common types of anxiety disorders. Now we're going to talk a little bit about social anxiety disorder, or what we call social phobia. So social anxiety disorder and social phobia, it's about 8 to 12% of the general population in the US. Again, that's a big number. If we realize that it's a population of 350 million people plus in the US. It's more common in women than men. Again, twice as common in women. And the average age of onset when it begins is between the ages of 8 and 15. And there's a childhood history of social inhibition or shyness. And shyness, I know what we're thinking. Shyness, haya, is a part of iman. But what we're going to describe here is not the shyness that's typical and normal. It's the shyness that actually is maybe to an extreme level that can cause issues down in the future. So we'll talk about that. So for example, when shyness leads us to a point, and prognosis is, how does social anxiety kind of affect a person over their lifetime? And, if people are anxious about being in social situations, the way it affects them is these people, unfortunately, a lot of times are unemployed because they're shy being in the workplace around other people, and they're single or unmarried because they're just they're very uncomfortable, being in any type of social relationship or any type of social commitment, including marriage, or they might be divorced or childless. And divorced, childless in particular amongst men. And only about half of individuals seek treatment. And when they do seek treatment, it's after 15 and 20 years of experiencing symptoms of maybe being unemployed, maybe being divorced or childless and unmarried, because there's all this fear of being in a social situation. They might suffer from this for 15 to 20 years before even considering seeking any treatment. Imagine if I broke a leg and I waited 15 years to see the doctor to get it fixed. That would be terrible. But unfortunately, with all mental health, issues and disorders, patients and people are not coming in for treatment, and they're not really diagnosed or treated for years, 5 to 10, or, even more years before they're even seeing the doctor. So, what is behavioral inhibition? So there are temperamental traits such as behavioral inhibition. Fear of negative evaluation is a risk factor. Negative evaluation is the fear that, if we are in the social situation, people are gonna, just kind of not, they will judge us negatively. They'll have negative evaluation. And behavioral inhibition essentially is a tendency to experience distress and withdrawing from unfamiliar situations, people, or environments because we might feel that people might criticize us, or people might think of us or judge us negatively. So we just avoid all of these unfamiliar situations, people or environments. And if there are first degree relatives of people who have social anxiety disorder, they're at a higher risk of having this disorder if there's first degree relatives who have it. The signs and symptoms. So what does this look like? Signs and symptoms are marked fear and anxiety about one or more social situation in which the individual is exposed to possible scrutiny by others, meaning, negative evaluation or judgment, possible judgment. And this could be, what could these social interactions look like? It could be as simple as, having a conversation, having a lot of anxiety and, fear about having a conversation with someone, meeting unfamiliar people, being observed by others when we're eating or drinking, or performing in front of others, like giving a speech. And so these fears can be triggered by perceived or actual scrutiny. Sometimes, people will judge us negatively and will be harsh, when they talk to us. So it could be a real fear, but a lot of times it could also be a perceived fear that, I'm not sure how they're going to react to me. I'm not sure how they're going to react to my presentation, or I don't know these people. I don't, what if they don't like me? What if we don't get along? So you know what? I'm not even going to do it. I'm not even going to present. I'm not even going to go there. I'm not going to leave the house. I'm not going to go to the masjid. I'm not going to do anything because you know what? People are going to judge me and nobody will like me. And I'm going to embarrass or humiliate myself. So I'm not even going to put myself in that situation. And that's it. That's what it kind of sounds like. So they fear they'll act in a way or show anxiety symptoms that will be negatively evaluated. They feel like they might be humiliated or embarrassed in front of others, and they think they'll be rejected or even offend other people. All of these fears and anxiety will lead them to just avoid any social situation. And we saw like what kind of things that can lead to down the line over years and years and decades. It can lead to a lot of social impairment and dysfunction. Can't have a job, don't want to get married, don't want to go out with friends, don't want to do anything, maybe not even want to go to the masjid because people might talk to me. And there are people, I have patients who don't leave their house, who will not leave their house, who won't have friends that they've known for years even come to their house because they're so afraid. They're so afraid of this engagement. So it can be very crippling. And so the social situations almost always provoke fear or anxiety. So now in children, younger children, what this could look like could be like, excessive crying, tantrums, freezing, clinging, shrinking, or failing to speak in social situations. Children do this for like a million reasons. This is not, if children are, like crying or freezing with their own tantrums, that does not mean that this is what's going on. These are just associations. But, as they get older, like, again, we said that it starts around age 8 to 15. That's when it starts. If we start noticing that they're selectively quiet and they won't speak, or around others, they just won't engage, and they eventually they'll just stop. They'll just stop participating at all, and they'll say, I don't want to go. I can't do it. And so the fear or anxiety is out of proportion to the actual threat posed by the situation. So, the fear and the anxiety that, young adults or children, adolescents or adults, this anxiety and fear is basically out of proportion to the actual threat that, they perceive from the social, they're like, I'm going to go up there and I'm going to give a speech. No one's going to like me. They're going to make fun of me. No one's going to be my friend. I'm going to be alone forever. And, so it goes from one thing and they start to catastrophize it snowballs. So the fear is out of proportion to what actually might happen. Okay, if I give a terrible speech, okay, yeah, they'll laugh about it, but they'll forget about it 2 days later. That's rational. But if I give a terrible speech and no one's gonna like me, no one's gonna be my friend, my parents are never gonna love me, they're gonna disown me, and now I can't even go home. So see, this is what's excessive. That's how it becomes excessive. So anticipatory, anxiety in social anxiety can occur well in advance. So for example, if I know that I have to give, a speech in school, or if I have to give a talk in front of the class, maybe it's a week away, but a week before, I'm already stressed out. And like, I'm starting to, have all this worry and anxiety. It's well before, like there's a week left. But even so far in advance, I'm already starting to feel these symptoms. So it says worrying every day for weeks before the social event. If there are the speeches, if there's a debate class, or if there's something, or for example, if I have to leave, salah in the masjid, or I have to give a talk, in the masjid or all. And now it could be a month away, but I'm already worried, and I'm already starting to panic, and I already am starting to have this excessive fear and anxiety. So this is interesting that there's some individuals have a real fear of public restrooms and avoid urinating when other individuals are present. Call it paruresis, term like a shy bladder syndrome. A lot of guys will not feel comfortable, using public restrooms when there's other guys present and things like that. So that's another thing. So individuals, so now we're going to talk about the performance type of social anxiety. So there's there's public speakers, musicians, performers, athletes. So the performance only type of social anxiety disorder, they'll have performance fears that are impairing, during their careers or professional lives. We call that stage fright. I'm sure we've heard the term stage fright, but their anxiety is only performance related. So they're not going to be anxious outside in other social situations that are not related to performing. So it's only in the context when they're actually performing that they feel this marked and severe anxiety. If they're hanging out with friends, or if they're going out, or if they're doing other social engagements, they're not going to have this fear and excessive fear. It's only during performance. It says blushing is considered a hallmark response for social anxiety disorder. It's considered that, so blushing. This is something interesting I came across. It's another scale, but it's a small screening tool. It's called Mini Spin. It's a mini social phobia inventory. 3 questions that are also scored on a Likert scale, with 0 being none at all, and 4 being extremely likely. These 2 questions: does the fear of embarrassment cause you to avoid doing or speaking? So does fear of embarrassment cause you to avoid doing things or speaking to people? And that's is scored on a scale of 0, no, not at all, or extremely yes, or extremely likely. Second question: do you avoid activities in which you are the center of attention? Do people avoid activities in which they are the center of attention because there's a marked fear of negative evaluation and judgment from others? So, and the last one is being embarrassed or looking stupid amongst your worst fears. Like if there are people out there, they're young adults and children, adolescents, whose worst fears are just making a fool out of themselves in front of others, and they nothing is a greater fear than just that. And so we talked about the Likert scale. So there's a cutoff score of 6 or greater. So again, it's scored on a scale of 0 to 4, with 4 being extremely likely, 0 being not at all. If we add up these 3 questions and the score is 6 or greater, there's a 90% accuracy in diagnosing the presence or absence of generalized social anxiety disorder. These are just 3 screening tool questions. So some treatment considerations for social anxiety. Again, cognitive behavioral therapy. Now here's the caveat. Caveat with the CBT in social anxiety disorder is that it's CBT with exposure. And we'll talk about what that means with exposure. So that's the first line, gold standard treatment for social anxiety disorder. So and it says here the gains from therapy, like talk therapy, the gains from talk therapy are longer lasting and more enduring than those achieved through medication treatment. So yep, hopefully everyone heard that, but I'll just quickly repeat. So CBT with exposure is the first line gold standard treatment. It's not medications. Medication is not the gold standard to treat social anxiety. You know, I can't remember, you know, I read something that's mentioned along, you know, the cure for a disease is its opposite. So if we have severe anxiety being in social situations, the opposite of that is exposure, exposing ourselves to social situations. So we can desensitize and over time normalize these social situations, and that is the cure. And that is what CBT, cognitive behavioral therapy, that's what it does. And the exposure part is this, you know, they'll work with people and educate them about the, you know, disorder, treatment, or self-help material. Exposure, this is key. This is key for social anxiety. So exposure to situations that are difficult to practice regularly in real life. So basically the therapist will, you know, do some role playing, like with the patient or with the individual, and, you know, kind of help them in treatment sessions. And then they'll give them homework. Okay, you know, I want you, if this is your social anxiety, I want you to do this. It might start with something really small, you know, to put yourself in a small social situation. And over time, they will build on that slowly. They're not going to tell you first session, you know, go give a speech to 1,000 people. You know, they're going to start slowly. It's like, hey, you know, maybe, you know, meet some relatives and meet some friends, and, you know, maybe, so they'll start gradually, and they'll give homework, and they'll work, and they'll do some role playing in therapy sessions and say, okay, you know, how would you respond if this happened? And they'll work out all those scenarios. And they'll provide, you know, role play simulations in therapy sessions, and you know, they'll basically assist in getting comfortable with this social anxiety over time, and it's very helpful. And something called cognitive restructuring. Cognition is just thinking. So cognitive restructuring, essentially what it means is changing the way we think. So therapists will help change the way we think. If we're very anxious or worried and fearful about a social situation, they will help change the way we, you know, think about it, you know, subhanAllah. So they will do this to reduce negative beliefs about ourselves and others, and work to reduce excessive self-focus. So, you know, the self-focus about social anxiety is like, I'm not good enough. I don't think I'm qualified. I don't think I can do this. I think people are going to make fun of me. So what they do is they instill confidence. And they will help us focus on our positive qualities and our positive traits. Oh, yeah, but you have done this in the past. You've accomplished this. You were able to do this. And when you did those things, you know, what was the outcome? Or if you did embarrass yourself in the past, how bad was it actually? You know, what was it as bad as you thought it was? So they will help us challenge these, you know, anxiety-provoking thoughts. Okay, so that happened, and that was a bad situation. You thought it would be the end of the world, but what actually happened when that happened? Was it the end of the world? And then that will help kind of like, no, you know, so something bad happened, but people forgot about it maybe in a day or two or a week, and it wasn't, you know, and they will this kind of helps restructure. We call this cognitive flexibility. Being able to think about things from a different perspective, or being, you know, optimistic. Reminds me of a story, you know, Prophet ﷺ in Quraysh, they used to, you know, the wife of Al-Lahab, they would call him mudammam, right? They would make fun of him. They would call him the dispraised one, or the unpraised one. And the companions used to get really angry, you know, like, how can they call him this and that? And, you know, he was the master of, you know, this cognitive flexibility, alayhi salatu wasalam. He said, his response was, you know, like, if somebody calls me, you know, insults me, or, you know, says something negative to me, I can become very fearful or anxious. But he said, you know, they're not talking, my name is Muhammad, they're speaking about somebody named Muhammad, but my name is Muhammad. So they must be talking about somebody else. So this is like an example of how he took a situation of being negatively judged by others, but he was able to have this flexibility to really calm himself. Obviously, he knew he was like who they were talking about. But in order to make himself calm and all the companions calm, he said that he had this view of really just diffusing the whole situation. So there are many examples in the Quran and Sunnah and Sirah that show how masterful he was in his emotional intelligence. All right. So that's what cognitive restructuring is: changing the way we think, trying to think positive. In the Deen we talk about giving the benefit of the doubt. It's the 70 excuses, all of those things. And social skills training is a treatment for social anxiety. So some people and here is they talk about helping individuals with social skills like making eye contact, how to hold a conversation, any issues with kind of interpersonal problems like not having a lot of social contacts or friendships or no social life, or just be too afraid to just tell what we think, or just being so afraid and fearful of sharing our opinion about any issue, whether it's school, whether it's home. We might shut down from our parents, we might shut down from our teachers, we might shut down from just any situation because we're not assertive. And assertive doesn't mean disrespectful. Assertive means that I can speak my mind without being afraid, and also helping managing conflict and dealing with relationships. And I think we're alhamdulillah, perfect. This is just about the last slide. And the last thing is emotion regulation approaches. And offering, therapists will help offer relaxation approaches, acceptance of symptoms and anxiety. And this is a big thing, subhanAllah. This is a very big thing. This is a big thing in psychotherapy these days. It's called ACT, acceptance commitment therapy. It's one of my favorite therapies because I think they got it from the Muslims. Acceptance commitment therapy. It's called ACT. It's better than CBT in my mind, in my estimation. What essentially it is, we don't tell patients that you need to change the way you think, but we tell them anxiety and fears are going to be a part of life. Bad situations are going to be a part of life. Allah says in Surah Baqarah, He will test us. All of these tests will come, but we will accept them. We will accept them as they come. But our response to all these tests and trials and tribulations will be based on our commitment. So acceptance and the commitment, and our response will be according to our values and principles. And as Muslims, it's very easy. We know our identity and our principles and our values. They're based on Quran and Sunnah. So we will accept. We're not going to say, why did this happen? Why did this situation happen? Why did I get a negative judgment? Why did this event happen? Well, why did these problems happen? We will say, Alhamdulillah, Allah said these will happen, and so they happen. I will accept it. Inna lillahi wa inna ilayhi raji'un. And then the way I will respond to them is what will please Allah and His Messenger. That's the way we will respond. And that's what acceptance and commitment therapy is: accepting that life is difficult. It's always going to be up and down. If you're up, expect the down. If you're down, expect the up. That's how we go through life as Muslims, alhamdulillah. So this is the talk today about generalized anxiety disorder and social anxiety disorder. Inshallah, we'll be emailing the group all of these slides for reference, and we'll go from there. Jazakumullah khair. Subhanakallah wa bihamdika, ashhadu an la ilaha illa anta, astaghfiruka wa atubu ilayk. The question is medications that can cause or trigger anxiety. any medication that has stimulating properties. So there's a whole host of medications that are stimulant medications. A lot of people on, ADHD medications, all of those are stimulant medications that will cause worsening anxiety. And a lot of times when we get, medications from the pharmacy, all of them come with a pamphlet and it tells you the common side effect. And we should read some of those to, see which ones will cause anxiety. But typically the ones that have activating properties, like for example, coffee, caffeine, people drink a lot of coffee. People drink Monster, people drink energy drinks. All of these things can get the heart beating really fast. People can go into panic attacks because they're drinking too much coffee, too much caffeine, too much Monster, too much energy drinks. So all of these things are, these are stimulating. They're like stimulant. It stimulates the mind, activates it. And if we overdo it, it causes anxiety.
You said people who live in developed countries are more likely to experience developed countries are more likely to experience. Why is that the case?
So I'll ask the question: why do people in developed countries experience more anxiety than undeveloped countries? Because subhanAllah, to answer my theory about this is people in undeveloped countries live a simple life. The menu doesn't have 52 options, that cause anxiety. What should I eat? What should we buy for dinner? There's not, there's a simple lifestyle. People live in a simplistic way. And, because of the simple lifestyle, they're blessed with not worrying about 50 things because maybe there's only 2 choices. And we can go a lot more into this in our group, inshallah, but in simplicity, there's beauty. So with that, we'll break for that.
You're gonna end.